I'm Dr. David Thomas. I'm a practicing psychotherapist in Tampa, Florida with Whitford Thomas Group, speaking to you today about causes of major depressive disorder. The causes of major depressive disorder can be varied here. When we're talking about any type of depressive disorder, there's two types of depression. There's a thinking depression and what we call an endogenous depression, which is a chemical depression. Major depressive disorder tends to be chemically driven, but not always. When we're looking at major depressive disorder, unlike depression, it tends to be a much shorter duration, but much more intense. So the symptoms of depression, which can be varied, but generally the symptoms of depression fall in the line of hopelessness and helplessness. So when we're hopeless, meaning that we don't think things are going to get better in our life, and we combine that with helplessness, as there's not anything I can do about it, we tend to create this depressed state, which often manifests itself in inability to sleep, eat well, get up and do normal activities, responsibilities. Oftentimes depressed symptoms tend to be that you sleep a lot. Depressed symptoms fall in the area of inability to concentrate, to focus, and again, motivation. So when we're looking at major depressive disorder, it's just kind of an expansion or a much more elevated state. Usually when folks experience major depressive disorder, it requires a referral to a psychiatrist or your family physician. Major depressive disorders oftentimes are difficult to think your way through. But certainly not all major depressions are chemically driven. Some are certainly cognitively driven. And we want to begin to take a look at what people are telling themselves to create the symptoms of the depression. If after a period of time the individual through counseling or psychotherapy is unable to minimize the depression, then certainly referral to psychiatrists would be warranted. I'm Dr. David Thomas, speaking to you today about causes of major depressive disorder.